Hello, this is Jill Wigmore-Welsh, Director and Clinical Lead at Modern Pain Care UK. So I'm recording some short podcasts around something called complex regional pain syndrome. And if you've managed to listen to any of the other recordings, then you'll know that this is a very interesting problem. It's not a problem that can be easily diagnosed with a blood test. And unfortunately, it seems as if, and I'm only putting it as it seems as if here in the UK we could be having problems with some groups of people developing this, what I call full-blown CRPS. And what I mean by full-blown CRPS is a whole sort of pattern of signs and symptoms which fit with what we call the Budapest criteria, and that I described in the first podcast I put together. A whole sort of spectrum of signs and symptoms which begin to start to emerge maybe quite early after a trauma, an injury, a fracture, or something similar. And it may be that the person begins to start to develop, and this may even be you, it may be you begin to start to develop some of the signs and symptoms. Say you have extreme pain out of proportion to the injury. So in other words, the tissues are mending, but you're still getting a lot of pain. And you begin to start to experience some of the other changes in skin sensation or sweating or lack of ability to move, etc., your limb. And unfortunately, I just do sometimes wonder whether if what's happening is that you're sitting out in the community, you're not quite sure what you could do, you don't know who to talk to, you don't know who to speak to, you've maybe had a chat with your GP. But of course, remember, your doctor is a trained generalist expert, someone who is a lead for a primary care team who's used to referring you on to someone else. It may well be that this particular clinician has never, ever encountered somebody with your problems. And it may be that they don't want to give you the wrong advice. And it may even be that they refer you across to a physiotherapist or even an OT or somebody in your local community. And it may be that the person that you go and see has never, ever seen anyone with the kind of problems that you have. So the first thing to remember is that this kind of problem is not common. So often after an injury or accident, people are able to begin to start to get moving. Their pain is in proportion to the injury that they have. And when you go to see a clinician or you go to see your medical practitioner, it may be that they've just never, ever come across a case like this. Now, it may be that just down the road, there is a practitioner who has come across something like this. But how on earth would you know? Where would you know where to go to get the right advice? Now, as a specialist, I've worked with literally tens of thousands of people. I've been working in healthcare for 43 years. And in that time, I've worked with people in just about every environment, every walk of life. I've worked with people who've had really quite big injuries. And I've certainly in clinic worked with people with what I would call all stages of CRPS. So I've worked with people who've had very, very early signs, so not presenting with all of the clinical picture. So they've got, say, a couple of boxes they tick, not all the boxes, but some of the boxes. Their pain is high, maybe the sensation is down, maybe the skin colour is down or whatever. And I've worked with people all the way through to those who've come in who've had extremely severe trophic changes, circulatory changes, all the way through bone mass loss, inability to weight bear. So I've worked with all of the spectrum. And in the main, most of the people, and I hesitate to say all because, you can't say that about anything, but most of the people that I've worked with have made a really good recovery. Have they become completely what we call asymptomatic? In other words, no symptoms at all. So in other words, never having any pain again, never having any problems with lack of sensation or this, that, and the other. And again, I can't say that. Certainly, a lot of people that I've worked with, a huge percentage appear to have been able to have a normal life. And that's really what's important. They've been able to get back to sport, to activity, to running, to walking, to shopping, to working, to living a normal life, albeit that they might still have some signs and symptoms. But really, in a way, I would almost say it's like somebody who's had severe burns or someone who's had severe injury, broken a limb. There is always perhaps a slight, if you like, a slight scarring, a slight limitation that's left behind. And is that acceptable? Yes, it probably is. If you have a big injury and you make sort of, a 90% or a 95% recovery, well, then that's pretty good. If you have a big injury and you only make a 30% recovery and you can't get back to work and life is no good, you can't get your hobbies, your family is affected, and this is one thing with this whole thing with CRPS, because it really does affect everything to do with your whole life. It affects you, it affects your emotion, it affects your pain, it affects your ability to work, it affects who you are, it affects you at every single level, your identity, your environment, your family is hugely affected. If you have children, if it's a child with CRPS, it's going to be that the whole structure of what your child does, their ability to play football or do gymnastics or riding or walking or just taking part in everyday running around a playground, studying, potential for going to university, long-term career prospects. All of these things can be impacted, and it's very important when you have something like CRPS that you actually are aware that it's not a common problem. It's a very small percentage of people. We are talking here, and I've got the diagnostic stats here. It's a very small number of people as a percentage who get CRPS. It says the European incidence rate is 27 out of 100,000 per year. That's actually a very low number of people who are presenting with this problem. So if you think of the average clinician, GP, physiotherapist, occupational therapist, even if they're people who are working in the medical sphere, so in other words, they're used to people going to see them when they've got a problem, this is not something that they're going to customarily see. So if you go and you see your GP, it's perfectly possible that your GP has never seen a case like this before. if you go to see a physiotherapist working at your doctor's surgery in the UK in an NHS system, this person has quite possibly never, ever, ever worked or seen someone like you before. So why is this important? Well, everyone is unique. So you're unique. You have your own personality. You have your own history. You have your own set of traumas. One of the interesting things about CRPS is that we don't really know why it is when you have an injury at this time, on this day, in this place, you can suddenly, instead of your system going as it should do and mending itself, it seems to start to go off in this strange way. So it's really important that you understand that if you go and you see your doctor, your GP, or you go and you see a physiotherapist or an occupational therapist, you might be the first case they have ever worked with. Now, I appreciate that, when you've got a problem, you want to find somebody local to you who is used to working with this. But the true truth is that this is a specialist expert problem. And you shouldn't be expecting to find that your local GP practice musculoskeletal physiotherapist who's providing services is going to have the experience. You shouldn't expect to find that they're going to have the equipment that you need in order to have some of the forms of treatment that you require. So you're also not going to find that your clinician is going to have the time to spend with you, because when you go to see someone and you've had this CRPSing start, you need time to have things explained to you. You need time to be shown what to do. You need to be able to have a program which is going to help you to have the best chance of turning things around. Now, at Modern Pain Care, I am the lead clinician and I provide services. I selectively find practitioners who are experienced, and it's not easy to find these experienced clinicians. I find experienced clinicians who are open to learning, who've completed science-based training in pain, so they understand about pain science, who are interested in understanding and learning about all of the various different and really quite complicated ways to work with your physical and your psychological, with what we call graded motor imagery and your proprioception, your body image, your ability to create new neural pathways and maps in your brain, and also to tackle the trauma that can be evoked by the injury, and also that your condition can create for you. So what I would say to you is that if you've got what seem to be early signs of CRPSing, or if you're presenting, or if you've already been able to identify yourself that, it very much seems to you as if you're ticking all these boxes, then the sooner that you reach out and get support and advice, the better. Because what we know is that pain management in terms of drug treatment needs to be provided by a specialist who understands this problem. The last thing that you want is to go and see a pain specialist who does specialize in medication, who immediately begins to start to talk to you about how you're going to need to have an implant, how it's all going to spread, a bit like going to see a prophet of doom, really. You want to go and see somebody who is going to be able to support you to believe that this is going to recover. Because we know that the power of our beliefs is absolutely huge when it comes to your recovery. If somebody says to you, do you know what? Nobody who has CRPS ever recovers. Oh, I've never seen anybody with this problem who can get better. The problem with that is that you have to be a very, very strong character in order to really sort of, I won't exactly rebel, but make that stance and say, well, that's not going to be me. So modern pain care is very selective about the practitioners that we choose to have working with us, and very selective and careful to find pain management specialists who really are aware that this sort of whole person approach, the sort of biopsychosocial life purpose approach, encouraging you to regain your ability to engage with life again, to feel life has a purpose, to get you back to doing what you enjoy, and also to use your hobbies and enjoyment and activities as part of your rehabilitation. This is incredibly important because ultimately, as I've already said, if you've gone quite a long way down the route of developing a lot of these signs and symptoms, unfortunately, if you haven't been using or moving your limb for 2 years, then it's very difficult to be able to predict how much improvement you're going to get. But if you don't move, unfortunately, you will continue to get worse. So the only thing that we can always do is actually to advise you to be engaging fully with a program and to provide you with the best possible support so that you are able to engage fully with the program and to make shifts and changes that your system has the potential to be able to make. So if you want more information, please do get in touch with me via the website. It's modernpaincare.co.uk. You can contact me via Facebook Messenger, and there is an email on the website. You can send me a message, you can phone me up. But as I say to you, what's really important with this problem is that as soon as possible, you get as much information and advice, and that you begin to start to really try to engage as much as possible in your own recovery. And if you'd like to talk to me, then I'm very welcome to have a chat with you at any time. Take care. Bye-bye.